storm has been rising. The sailors in the boat, that is Kenya, have been steering the ship into the headwinds, and now the country is officially in its third wave of the Covid-19 pandemic. And you, Kenyan, may just be facing extended and possibly more stringent containment measures when the president addresses the nation on the pandemic situation on Friday. Our very own Eunice Omolo will be reporting that Africa CDC has listed Kenya as being among the countries with the highest increase in infections and deaths in the continent, looking at the fact that just today we've witnessed a 14% positivity rate out of the 713 new cases that were reported today. 713 marking the highest in this year in a single day, and that number has been rising constantly. And here's a report by Eunice Omolo.
It is written, you reap what you sow. And what many saw coming, what was a building up storm, has arrived.
I want to make it official today and to say that Kenya is already in its third wave.
Just 2 days to the presidential address on the COVID-19 situation in the country, and there appears to be some writing on the wall.
Now the time has come to start looking back at some of the measures that we have taken, whether to increase and to stop and make some mandatory requirements of our population.
The situation is largely a man-made one.
And there are a number of things that are contributing to this. One is going back to school. The schools were opened in Kenya, so it meant that there was going to be now more interaction between school kids, teachers. Number two, we have seen that in this country we are like in an election mode. We are seeing very large gatherings by politicians. And if you look at these gatherings, a lot of people don't wear masks. Even if they do wear a mask, they don't wear them properly, and they are very close to each other. Transmission of COVID-19 from the countries that are neighboring our country, Kenya. For example, if we talk about Tanzania, they never put in place measures to control COVID like we did. And eventually there seems to have been a major spread of COVID-19 in Tanzania.
Currently, 20 countries in Africa are reporting one or both of the global variants of concern, that is, those discovered in the United Kingdom and in South Africa, with Kenya being among them alongside South Africa, the Democratic Republic of Congo, Gambia, Ghana and Rwanda being countries that have reported both variants. In the past 5 days, Kenya has experienced a total of 2,627 new infections and 25 COVID-related deaths. This is more than double what was recorded on similar dates in February, where 714 people were recorded as having contracted the disease and 12 patients succumbing to it. Among the most populous countries listing in the 4 weeks trend analysis by the Africa CDC, Kenya had a 23% average increase in confirmed infections after Ethiopia, which recorded 13%, and Egypt registered a 1% average rise. Africa CDC data indicates that Kenya's increase in deaths stands at 26%, coming second to Ethiopia, which has recorded a 37% increase.
We are seeing that patients are even presenting with diarrhea, discoloration of skin, headache, things which were not originally there, meaning that these variants which are circulating may be actually behaving differently in our bodies.
Kenya is among 28 African countries that have received the COVID-19 vaccine, 19 of which have received it through the COVAX facility and 9 through the bilateral agreements. 16 countries, again including Kenya, have started vaccinating their priority populations. Eunice Omolo, NTV, Nairobi.